pains and how we hide them. I'm not Chris.
And I'm not Karina.
But we're here together.
As usual.
And we're back with some really cool topics that actually our Discord helped us pick out.
Yeah.
Which is fantastic, and I love that.
It was a good live.
Yes, we had a really good live yesterday.
Good.
It was a lot of fun.
It went by quick.
I know. We were on for like at least an hour and a half.
Mm-hmm. It didn't feel like it, though.
Uh-huh.
Like, I looked down at the clock, and I was like, oh, my God.
And we had a lot more people able to participate because we did it a little bit later. So I think we'll continue doing it later.
Around 6-ish.
Yeah.
5:36.
Mm-hmm. Yeah.
Gives you time to decompress, too.
Right.
And then we can get into it.
Come home from work and actually put on a face and come and do stuff.
It was good.
But it was good. It was a lot of fun. Great talks. If this is your first time with us, hi. We are two zebras, meaning we have HEDS, and we like to talk about being chronically ill.
Well, we don't. I guess we do like to talk about it. It just sounds like we go around life always like we're those people that's like, here's all my trauma.
I'm not sure how we want to like put that out there. He keeps telling me that I'm good at these things, and I'm really not.
She is.
Sometimes I word, and sometimes I just don't. My word is not connected to the brain.
It's fine.
But yes, so we have HEDS along with a lot of comorbidities that kind of go along under that umbrella. And this is our season of many voices. So we are having lots of fun getting to hear from a lot of different people in a lot of different situations.
Yep.
And kind of finding those common experiences, because there are a lot of things kind of across the board that we can all relate to and commiserate about.
And we have guests planned.
Yes.
We might have at least two.
Yeah.
If we can get a hold of one of them.
Mm-hmm. I'm really excited because next month is EDS Awareness Month.
Hey.
And it's also going to be our 1-year birthday pretty soon, May 3rd.
I just realized, like, we've been talking about the date and that it starts. I didn't realize that we started our podcast during Awareness Month.
Uh-huh.
That was so unintentional.
Yeah. Well,
it just
lined up. Happened.
Yeah.
Everything we do just kind of happens. It was actually really funny with the live yesterday.
Yeah, we were trying to come up with ideas. And
like, how do you usually do this? I don't know.
We just do
we
it.
Sit down and we're like, let's talk about a thing.
Yeah, there's not a lot of pre-planning.
Yeah, no, not so much.
Because we work better. The podcast is better when we just say what we feel at the moment. So
right. Well, and we're a lot more experiential and less on the clinical side of things. So this is where you're going to hear a lot more about like the day-to-day experiences that we go through and less about what those disorders are.
We get into it a little bit, but we're not medical professionals.
Yeah.
So
less jargony.
But if you're listening to us on Spotify or our other platforms, you can watch us on YouTube.
Mm-hmm.
There's a lot of visual interaction. And if you're watching us and you need to just listen to us, we're on most podcast sites.
Yep. So if you're tired of looking at us, you don't have to. It's okay.
Yeah. You'll be free. Go. Be free.
Be free. And I'm so sorry. No. We're also on TikTok. We haven't been super active, but we have some funny stuff there from the days gone by.
I'll make more.
We have a bunch lined up. We just have to do it.
Mm-hmm.
But yeah, so this is our podcast.
Freudian slip. We
know,
make no money from this, just so you know.
He's usually the one who's like, and Venmo me. But
don't
podcast. No. Podcast / YouTube channel. And I don't know where I was going with that. So we're going to stop talking for a moment.
What time is it?
And reboot with the time for the weekly recap.
Check in.
Yes. Do you want to go first?
I can.
I need to reset my brain.
Yeah, I have to remember this week again. I always just space. It's like it's time for the weekly recap. Brain fog.
Did I have a week? What's a week?
Yeah, 7 days passed since I did this.
I don't understand time.
What did happen this last week? Oh, I cleaned a bunch. That was it.
Yes.
Lots of house cleaning and fun with kids.
Mm-hmm.
Our kids have made friends with people that are finally coming over. And
just cool people,
they're doing
too.
Like sleepovers.
Mm-hmm.
So there's been a lot of that, which is good for them.
Mm-hmm. Yeah, last weekend I think we had some kid noise in the background.
Yeah.
So you might have heard that.
The chaos.
They were having a really good time.
Yeah. They're good kids, though.
Yeah.
So they pick good people.
Mm-hmm.
What else? What happened this week?
You had doctor's appointments?
Oh, yes. I went to my pain management meeting.
Yes.
it was scheduled for 9:30. We got there at 9:30, barely at 9:30. We were like, "Oh, sorry for being a little late." They're like, "You were really late. You were supposed to be here at 9, and we're really booked today." So basically, they wanted us there early to fill out paperwork. We just didn't know we were supposed to be there early for paperwork.
Right.
We went when they told us to be there.
I don't understand that. Like, if you're going to schedule something and be like, show up early, just schedule it for the early.
Yeah, no shit. So they were very like caught off guard and like pensive, I guess. They were like, "Oh, we're gonna have to reschedule you," and we're like, "Great, that's fine, perfect, works for us." And they were very appreciative. They
They
like,
thought
"Thank
you were
you
going
for
to
being
fly
awesome."
off the handle. Yeah.
Yeah, and then we rescheduled with my actual pain management doc,
Mm-hmm.
the one David, the one I've been trying to see,
Yes.
instead of the intake lady.
Yeah.
And it's scheduled for like 2 weeks from now, so it's not bad.
Yeah, that's not too bad.
I mean, it wasn't a big deal. I'm sure it could have been a big deal, but
Great.
I was so
but
chill that
they
day.
took care of your like refill and everything,
Yeah.
and made sure that you had meds to like get you through
Exactly.
until then. So that's good.
Yeah, they were very much expecting us to fly off the handle and lose it. We were just like, "Okay, cool. Have a good day. Sorry about that."
Yep.
And then they apologized, and I was like, "Don't apologize.
It's fine. Yeah.
Life happens." Yeah, I think that's pretty much. I've been spending a lot of time with the kids, which has been good.
Yeah.
Lots of stuff. I did toe surgery. That was the thing.
Explain that a little bit more.
I had ingrown toenails on both of my feet, and I fixed it. I fixed it on both of them with at-home surgery, as
Yes.
Randy likes to call it.
Yeah, my husband caught me doing it once and was like, "What are you doing?" And I was like, "Fixing an ingrown." And he just went, "Oh, you're performing surgery on yourself." And I was like, "Oh, I guess so."
Right. But this time Rory watched me do it, which was weird.
And he's just turned 7.
8.
8.
He's 8 now. Yeah.
That's not okay.
So I'm sitting on my bed, like curled up with my foot in my face.
Mm-hmm.
You know, EDS positions.
Yep.
And I'm just taking out toenail chunks that are left over. Didn't hurt. Don't freak out. I didn't feel it.
Right, like you just pull them out of there.
Yeah,
It feels better.
it does. The relief was so worth it. And he's watching. He's like, "Does it hurt?" I'm like, "No." He's like, "Can I touch it?" I was like, "Okay, you can touch it."
Because you took off your entire toenail.
On this side, I had to.
Yeah.
The whole thing had grown in wrong. Like I banged it when it was growing in,
Mm-hmm.
and so the front end was literally just this thick with like
Oh.
toenail. I
So it
couldn't
was
get
just
through
like
it.
plating on top of
Mhm.
itself.
And it was
Ugh.
impacting at the end. So I had to fix it. And I did. And he watched and he was intrigued the whole time. He was like,
It's so
"Wow."
funny.
And it was just weird doing that with an audience.
Right?
Normally Jen just rolls over and ignores me.
Yeah.
He was like, "Whoa."
My husband just rolls his eyes and he's like, "You're ridiculous," and then he leaves.
It feels so much better though.
Right? Oh my god.
I can walk in it.
Mm-hmm.
And it was hurting on the foot that I can't feel anything.
Really?
Yeah, it was the ingrown was like deep down.
Yeah.
So like I said, I can feel like really deep sensation. And I
So-
was feeling the aching.
Was it weird to have it like talking to your brain again?
Yeah.
You're
No, it
like,
was
"Ow, there's
Ow.
a thing here. Ow."
I have a toe? Ow. But
oh no.
it's all good.
Mm.
And then other than that,
Well, okay, no, not other than that, because we compare ingrown toenail pain to
teeth pain.
yes.
Lots of tooth action this week.
Yeah.
Like nothing, I don't think I chipped or broke anything. It's
Nothing
just been
new, it's
hurting.
just more painful. Yeah.
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 Like I coated my teeth in Orajel before we went on. Like I'm gonna not feel it. But I do.
Did not do that, but I also have a broken tooth
I have a hole in my lip.
that's been a problem. I saw the dentist
Yes, you did.
and they were like, "I think it's dead," but also I think he was expecting me to jump out of my skin when he was
did
doing the cold test.
Yeah.
And he was like, "Can you feel this?" I'm like, "Yes." And he's like, "Can you feel this?" "Yes." He's like, "Well, I think it's dead and you're only feeling the infection." I was like, "Whatever.
Sure.
Okay." So I'm scheduled. I actually have to move my appointment, so it's not going to be fixed on Wednesday, which is a bummer. But we have like a wellness fair at work,
Oh,
and I
yeah.
have to be there because they need everybody they can get.
Yeah.
So I'm going to have to reschedule, which is
I just realized that the one thing we don't do is
Hmm.
dentist shopping because insurance is so
I basically do a different dentist
Every
every
time?
year. Yeah. I don't think I've gone to the same dentist.
I go to the same place, but it's always a different dentist. Like, they go through them because it's Bright Now, and I hate it. I hate it.
I was doing, it was at Bright Now, Iliff, I think.
Mm-hmm.
No, Hampton. And then now I'm at the Hampton Dental Group.
See, I want to find like an actual dentist that'll work with me like long term.
Right. Well, and somebody who understands like EDS and isn't gonna guilt you for your teeth being bad.
But our dental insurance sent us a paper saying this is the dental place you should be going to. So we have to go there, and the kids have a different one.
Oh, interesting.
Yeah.
I have dental insurance, and it covers exactly $1,000 per year.
The same. I'm pretty sure mine's the exact same.
Yeah. They don't cover jack shit. And it's not even like an option to have good dental insurance.
No.
Which pisses me off. I hate that so much. But, okay. I'm going to move away from dental. But back to
your week.
My weekly recap. I just had a really heavy emotional weekend, I guess. Like,
yeah. Oh yeah. You're coming out of that.
Yes. Like we're in break time now. It's like time out, but I'm fully expecting it to
ignite.
Yes. Reignite is a good way to put it. But so I had a guest in my house this last week, which was fine. Like, it was all good, but it was just a lot of emotional labor all week long. And then I'm trying to think what else happened. I saw my pain site and she broke me.
Yes. She broke me.
Yeah. Well, because we were talking about it just a minute ago, and we're like, oh shit, we learned the same screwed up maladaptive lessons.
Yes, we
did. In
did.
childhood. Wonderful.
Huh.
But, so that was interesting. It was a weird talk where, like, we talk about, like, not wanting to be a burden and fighting to not be a burden, but fully believing that we are still a burden.
Yes.
At every waking moment.
Yes.
Yeah. So, yeah, it wasn't, like, super crazy or anything. It was just really, really exhausting. And fatigue has been so unbelievably bad. Is it blowing cold air?
It just turned the heater on.
Oh, weird.
So I'm closing it. Go on. Just ignore me doing weird shit.
He's closing the vent. Yeah, heavy emotional week. Really exhausting. Fatigue was really bad.
Mm-hmm.
Fatigue has just been really bad
overall.
Fatigue
has been, like, weeks of horrible. And it's everybody we've talked to.
Mm-hmm.
Like, when we were doing the live, everyone's like, yeah. It just won't stop.
Mm-hmm. Well, and then I had the cane last week, right?
Yeah.
And so I had that for a few days, and then I was just standing somewhere, and suddenly my whole pelvis just, like, went ka-thunk.
Yep.
And just dropped. And then I was able to, like, move again. So I'm coming out of that pain, which is great, thank God. But the tooth pain has been really bad, and it's turned into, like, jaw pain and like facial sinus pain, which sucks. And the dentist was like, you have an infection, so here's an antibiotic.
Which is making you nauseous.
Exactly. So it's just one thing after the other forever. It never stops. But I did have massage, which was great.
I think part of what's making everything, like, worse for you is that even if you have a week off, you don't get a week off because that's recovery.
Yeah.
So there's not a normal week. There's chaos, and then your week off, which is just recover week.
Yeah.
But you still have to do all your responsibilities.
Right. Well, and I have 6 weeks of this. 6 weeks left. 6 weeks left. Well, and everybody in the building, there's like 3 people who are still doing their jobs.
End of the year, who cares?
Yeah, pretty much. But I'm like, we can't do that for 6 weeks. If we were like at week, like we had 3 weeks left, cool.
Maybe.
Yeah, like everybody, like, fuck off. That's fine. We could all dick around. But we've got 6 weeks left, and nobody's doing what they're supposed to be doing. And it was chaos because it was SAT and PSAT, and half of our building was out for conferences.
Good planning.
Yes.
Really lined that up well.
Why did you do this to me? Why? But yeah, nothing too crazy. Just, well, I lied. It's all crazy. But it's all right.
You're managing.
Yeah. I'm doing okay. And then my husband's been really good about taking some of the load from me, especially with the emotional stuff going on.
It's really helpful, I bet.
He's been on top of it. I've
Hell
been
yeah.
really impressed. So, yeah, I'm just like, I need some rest at some point.
And keep in mind, he doesn't watch the podcast.
No.
She's not saying it to make him feel better. She means it.
He did a really good job. So what's our topic today?
Let me look at the paper because I forgot. I don't know what we're doing. Oh, we're doing medical shaming and weird
medical shaming, medication shaming,
medical shaming in general. Because I was thinking about it last night.
Mm-hmm.
Just in general, shaming for the things you believe in, like what you use.
Oh yeah,
was part of it.
Yeah,
medication shaming and medical shaming.
Yeah, okay.
And then we'll get into like imposter syndrome and masking if possible. If possibly.
Sounds good. Oof.
So the genesis of this conversation was a Facebook post, a reply to one of our video uploads, which basically was shaming people for using Western medicine.
Yeah. I mean, it wasn't like aggressive, but it was definitely one of those, like, you can see their worldview in what they were saying.
Yeah.
And it was definitely like this sense of superiority because it was like they made it this far in life, treating things as they popped up.
Right. She didn't believe in medication.
Yeah. It was basically like, I've done better treating everything naturally as it occurs.
Right.
Than people who have committed their health to doctors.
This is an older person who had spent most of their life without knowing the diagnosis. So they already had systems. You know what I mean?
Right.
It wasn't new and then treatment. It was somebody found out and was like, oh, okay, well. That's
what that is. Yeah.
Yeah.
And that's the thing is that, like, with EDS and with hypermobility spectrum disorder, it is a spectrum.
Yeah. Oh, yeah.
Which is why, like, it's the same thing. I don't care what anyone says. It's the same thing.
I'm on that boat too.
That's how I feel about that. It is the exact same thing, and we need to stop with the, like, well, mine's better than yours, or like, whatever.
Right. There shouldn't be a comparison drawn between people.
Because that's the thing. Like, awesome for you that you made it that far in life, treating naturally. Like, that's fantastic, and I'm so glad that works for you and that you have relief that way. But we also have to acknowledge the people who are really, really heavily impacted. Yeah. Where, like, we see it all the time with people who have ports or have G tubes or J tubes or have to have like trachs for because their dysautonomia has shut everything down. Mm-hmm. So it's not fair to say that, like, well, the natural route is better empirically, like, that's it.
Right. No, that can't be true.
No.
But also, that's not saying that Western medicine is the way to go either.
Right. And it has to be a balance, and it has to be for you. And we can't be like, I am better than you because I've made it work this way.
You're not better than anyone. You just figured out how to function.
Right.
You figured out your path.
Like, you figured out how to make your life work.
Let's celebrate the fact that you've made it this far with what you've got, and then understand that I need medications to function.
Right. Which is why, like, looking back, I'm actually proud of how I responded to that.
Yeah.
Because I think in my younger years, I would have been like, well, goody for you. Other people have it worse.
Yeah.
Like, clearly you don't have it as bad.
Yeah.
Would have been the route that I would have taken.
Younger Karina would have absolutely done that.
Yeah. But I basically was just like, I'm really glad that works for you. And awesome. Yeah. But also, other people have different bodies.
Oh, yeah.
And different things that affect them and different comorbidities. And that makes a huge difference, I think. Mm-hmm. Because just EDS is only like a very small sliver of the bigger picture that we have going on at all times.
Yeah.
And, like, even within our family, it's a spectrum.
Oh, totally.
Where you're the most highly impacted. But I think I progressed the fastest.
In, like, a window.
Yeah.
Like, you're slowing down, I think.
Yeah, actually. Well, and I think it's because of all the preventative stuff that I've started to do.
Your 23 to 27 was definitely more aggressive than mine was.
Yes. Well, because I was with you, like, neck and neck for a lot of what was happening. Like we had the same things going on at the same time.
You've had almost every surgery I've had, minus the tumor.
Yeah.
And like
on one shoulder.
And you're only what, 7 years younger than me? Like,
yeah. So I mean, and our younger brother is, I think it took him longer to realize that he was impacted, and then he's been kind of progressing at a steady rate. So
he's still finding things.
Yes.
And he's trying to be nice to himself, I feel, but just the same way we try.
Right.
Like, there's only so much you can do. You still have a job. You still have to, like,
exactly.
You have responsibilities.
Well, and he has a very heavy manual labor job. So he's abusing himself constantly.
I feel like he's doing it mindfully, though.
Yes. I think he absolutely is, because I think Star holds him accountable.
Yeah, good. Thank God.
They hold each other accountable, which is good. But we see so much shaming that takes place within the communities.
Yeah.
Not even just like within our communities, it's within the medical community as well.
Anything in medical.
Yeah.
You find people who, it's like you can predict what's going to be in the comments. It's going to be someone who the operation or whatever they're talking about didn't work.
Yeah.
And they should never consider it.
Yeah.
Then there's going to be one guy who's like, no, actually, I lived through this. So this is my daily. And it helped me like night and day.
Yeah.
And then there's the people who are going to be like, well, you should feel bad. Like you're not doing what you should be doing.
Right.
And then there's always the one guy who's like, hey, have you tried this medical supplement that changed my life?
I hate
10 out of 10 doctors hate this medical trick.
Message me for details.
Yeah. It's not a pyramid scheme. It's just a triangle-shaped marketing schema.
Schema.
Yeah.
Yeah, no. Oh, it's terrible. I'm trying to think, like, specifically what we've come across. And
man.
I don't know. For me, like, it's ringing the same bells as hearing, well, oh, you're too young. And you're like, oh, my God, stop. But the first one that comes to mind is, like, gabapentin. Where people are like, you should stop taking that. That's going to kill your nerves.
No, absolutely. When I started taking it, I did research and everyone talked about how bad it is and how it's going to ruin everything.
Yeah. Oh,
it's
was
been
like
the complete opposite for both of us.
Yes.
It's been like life-changing.
Yeah. Like functionality improved dramatically. It was insane. And then I can't imagine coming off of it at this point.
I've done it a few times. It's not fun.
It doesn't sound fun.
No, like, because when I transitioned from Lyrica to gabapentin, or gabapentin to Lyrica and then back again.
Yeah.
There was the adjustment period between.
Oh, okay.
Where like I didn't taper from the Lyrica to the gabapentin, so
I
stopped one immediately, went to the other one, and I felt it.
I did not. I felt a drop in like effectiveness for a little while.
Right.
And then it picked back up, but it wasn't like super dramatic. It was more like I had missed a couple doses.
Oh, see, that would have been preferable. My body was like, this is completely different all of a sudden. And now we're going to be mad.
The dose of gabapentin that I was on, they were like, that translates directly. Yep. And so they had me just go directly from one to the other.
They lowered mine.
Right. And you went the other way too. And I think Lyrica is like the heavier, dutier version.
Yeah. It just gives me bad side effects.
Pregabalin, whatever.
Otherwise, I would still be on it.
Yeah.
I just get the...
You get like light
flashing
hallucinations.
Yeah, I see like weird light shapes and
yeah.
Get time jumps if I take too much.
That's
creepy weird time jumps. I need to record it. I should have like got my camera out because to see what happens when I'm blacking out in between.
Yeah, like
because it's literally I was moving a bed one day and I was holding the mattress one moment and the next I was in the bathroom.
Oh, weird.
No clue how I got there. What happened in between.
You just checked out of reality.
That happened a few times.
That's so strange.
So, yeah. That's why I'm on gabapentin now.
Yeah. Well, and it was funny because Kaiser was like, I don't know. I was talking about how I still was getting like the hot hands and the hot feet.
Yeah.
Which I hate. It's just like a burning sensation. So bad. And it like occurs with the MCAS flare-ups.
Yeah.
But the nerve pain is so bad. And they were like, well, we just got approval to use pregabalin. Like, it's just now covered by Kaiser. So here we go.
Nice.
It just seemed like they were really excited to prescribe it, which was funny. What other instances have we come across?
Well,
medical shaming or medication shaming.
The biggest one I always come across is like the people who take pain meds versus the people who don't.
Yes.
Because there's stigma and then there's bias. For like, I feel like
Well, a bias and like almost defensiveness.
I was gonna say, I
like
feel like
you have to justify yourself.
some people who had pain meds and stopped are angry that people are still taking it and they're not.
Yes.
I get a lot of that, like pent up anger.
Right. That's kind of how I felt about that comment too, was that like, I suffered for this long, so you should be able to also. Don't be a baby about it. Which is wrong. We should never wish suffering on other people just because we have had to endure it.
Yeah. But that's like the biggest one that I always come across.
Pain meds is huge, yeah.
Yeah. I feel like some people come from a good place though. Where like they're like, I've managed without it. You can manage without it. Like they're hoping.
Right.
They're not wishing anything on you. They're just like, have you tried doing this other stuff? Because maybe you don't need to take them because they are not great to be on all the time.
Right.
So, but then there's the jagged people, all the jaded people that are like, oh no, you can't. People who take meds they're just babies. What are they thinking?
They're all addicts.
Yeah, we're addicted babies is what it is. We don't know better. How are we conning all of these physicians into giving us pain meds? What is this?
It's that same like, well, pain meds will make the pain worse in the long run. And you're like,
they can.
Can, but they don't have to.
Right. If you're responsible. At least.
Well, and it also depends on like your genetics and your body makeup and your chemistry.
There's a lot of
like
inherited,
we know that,
like addiction.
Like addiction itself is very, what?
How did you do that?
I just pulled fidgets out of my coat.
Did you
They
have
were in
fidgets?
my pocket. Yes, they're my ones that I stole from myself at work.
I thought you took them from over there. Okay,
would you like yours?
No, it's fine. I'll get them at break.
Okay. Or we could do it at camera shift if we go that far.
If we go that far.
If we go that far, you know. I don't know what I was saying now.
Yeah, we were talking about pain meds.
Oh, yeah. Okay.
And people who...
Oh, addiction is largely
addiction
genetic. There's a lot of other aspects, obviously, but we know that depending on how you are built as a human being, as a unique human being, that the different things do different things.
Right.
And they work different ways, and they have different effectiveness, and they have different risk factors.
Yeah.
Like, even you and me, and we are siblings, by the way. We're half siblings. Like, I don't get side effects almost ever.
Right.
And you are super sensitive to medication.
Yeah. Oh, yeah.
Just in general.
Exactly. Like, versions of a medication mess me up.
Yeah.
I'm the reason they make different versions.
Right.
Because there's only one specific pain med that works for me at this point. And there's same with like the Lyrica. There's some other meds that I've had to not take because the formulation and whatever are not good.
Yeah.
Like, I can't take straight up Adderall or Ritalin. But the extended release version I take works just fine.
Which is interesting because, like, I don't know. We've both had bad experiences with extended release versions of things, especially pain medication. Like, extended release pain medication is no bueno. Don't like it.
All the nausea.
Yeah. Really, really bad nausea and, like, full-blown sweating fits and, like...
Nah.
No fun. Not good. But, I mean, I guess we are kind of similar in the way that, like, we only have the one pain medication that works.
Yeah.
Because for me, it's not that the other ones are, like, bad necessarily.
Right,
they just don't. They don't have any effectiveness.
Yeah.
And so we moved away from that because
we're just both ends of the spectrum.
Right.
Hypersensitive and then not sensitive enough to be.
Yeah. Yeah. Where, like, we tried, what was it? Tramadol?
Yeah, tramadol.
Tramadol is no good. Like, no good. It just doesn't do anything.
Right.
It was like Tylenol that was less effective than Tylenol.
No, yeah, the Tylenol was way better.
But you've tried a lot of different ones.
I think I've tried everything. I know I've tried everything Medicaid covers. And I've tried some other stuff like in the ER.
Yeah.
They've given me different ones. And usually, like, they dope me up with Zofran.
Yeah.
So I don't get nauseous because I tell them, like, I'm going to get sick on this.
Right. How do you do on morphine?
On morphine, not bad, actually.
Yeah, I was given morphine once.
The just straight morphine pills that aren't mixed with anything, I took post-back surgery, and they were really good.
Okay.
Like, they were really effective. They didn't make me sick.
Good.
They sucked transitioning off of because they were
It's
like back
morphine.
surgery, very heavy, and we went from like a high morphine to a lower Percocet.
Oh yeah.
Like there was no changing, and it dropped at the same time, and it was rough.
I've noticed that about like surgical medication. There's
Mhm.
no like
Mm-mm.
end care.
Right.
Like
there's no step down.
there should be some kind of aftercare. And I think just thinking about this just now, I think that would have a major impact on people's outcomes when it comes to addiction.
Mm-hmm. Yeah, because that's a lot of addiction happens from post-surgery.
Is like, okay, you're good now, no more meds, bye.
Right. And where are they going to get meds then? Like you have to go to
Mm-hmm.
the streets.
Yeah. Well, and yeah, because there should be like a titration that happens. There should be some kind of transition that happens.
Hell,
They
even
should
if they
be
did,
monitoring your
I was going to say if there was
transition.
like a program for it.
Yeah.
Like if they just included like therapy in part of it.
Right.
Like you just did a traumatic surgery.
Yeah.
Let's talk
Well,
about this
especially-
uncomfortable subject.
Especially because I think a lot of generally well people who have surgeries expect that surgery is going to fix it.
Yeah, that would be.
And then they wind up with like pain after surgery.
Mm-hmm.
And that's new and different and hard.
Yeah.
And like you said, there's not like counseling that goes along with that. And there should be. And I'm sorry, it shouldn't be the patient's job to like think of these things.
No.
Because they're not going to, because they don't know any better.
Well, here's the thing. We'd have to do the research. We'd
Yeah.
have to see if it's cost effective to get people, you know what I mean? If it's too expensive to get them off of the meds safely
Yeah.
and get them help, then it's not going to be worth it.
Right.
But
Well, and then other people, like other places go way too far the other way,
mhm.
where I've heard horror stories recently about people having pretty major surgery and being like, okay, here's Tylenol. See you.
Yeah.
Bye now.
Yeah, been there.
Like, I know you were on IV morphine for the last 4 days in the hospital.
You had a bolus that you could hit buttons on every
Uh-huh.
fucking hour, but
But here's some extended release Tylenol. Have a good time.
yeah.
Goodbye.
No, that's legit.
Yeah. Ooh, bad.
Mm-hmm.
Yeah. But yeah, no, pain medication is a big judgy one. Like a really big judgy one.
Mm-hmm.
And I think part of it comes from just fear.
Oh, yeah.
People are scared of pain medication.
I
and
was.
My husband was.
Oh, yeah. Very recently.
Whew, it took him a long time to like come to a point where he could trust that this was okay.
Yeah.
And our current management is okay. And it works. It works for me, and it works well enough that I don't have to take it every day, and I don't have to
Yeah.
worry about like throwing things on the floor.
You're right.
But yeah. But it's scary. Like all people hear about it are the horror stories.
Yeah.
And they don't consider that some people really, really need that to be functional.
Mm-hmm. Yeah, well, especially in the chronic community, like
Mhm.
that's just the division. Either you are pro med or very much
Yeah.
against the meds.
Well, and we see it with providers too.
Oh yeah, providers are.
Even pain management providers.
I think we've talked about, but like you get judged
Mhm.
when you go over your med list.
Yeah. Yeah. Like, oh my God, if I go to gastro ever, they're always like, oh, you take Percocet, so that's clearly the cause of all of your gut issues.
Mm-hmm.
And you're like, no, no, it is not.
No,
And then they just stop listening.
that
Like,
happened to me.
As soon as they hit like, oh, you take Percocet, they stop listening entirely.
Right, I had that happen to me in the ER once. Remember when I had the really bad side pain?
Yeah.
And we were still figuring out what it was,
Mhm.
and we were also trying to figure out if it was Marfan's or not.
Yeah.
I went into the ER. I was sent by my doctor, right?
Mhm.
She sent me in. She was
Oh,
like, you
I
need to go in
this.
and have them look at it. Like, I'll send them to the tests that I want done.
Yeah.
I get there, I get checked in, and some students are working on me. Fine, whatever. Go over the list of medications I'm taking. Oh, no, you're on pain meds. Have you thought about constipation? I was like, no, I went to the bathroom this morning. Like,
Mhm.
I'm fine.
Yeah.
They didn't believe me.
Nope.
So they did imaging. They're like, oh, you're backed up. I'm like, no, I'm not. I went to the bathroom this morning. This is probably just food that I ate.
Yeah.
Imagine that.
Right.
And then they insisted on doing an anal examination.
Oh my God. Oh, that's the gauntlet.
Yeah, that was the gauntlet. They were
Oh.
like, oh, prove it to us, basically.
Uh-huh.
Let us stick our fingers up your butt. Let 3 students do it. They need to learn
Yeah.
and feel around for papules or whatever.
Yep. Yeah.
And then I never got the tests I needed done. They didn't. They shut off as soon as they saw pain meds. and they saw that I had shit in me.
Yep.
They're like, no, it's constipation. You're making everything else up. It's not as
Yep.
bad.
Yeah.
Didn't get any of my testing done.
Nope. Oh, it's the worst.
It was a tumor in my back. They could have found it that day. Had they done the imaging,
That's
they would have seen the tumor.
crazy. That's crazy.
But, you know.
My God. Yeah. No, there's just, that one's huge.
Yeah.
Absolutely huge. Like pain medication, top tier judgment. And then you have like the kratom community.
I was going to say, next up, there was a guy in our group therapies that got in trouble because he was using kratom.
Oh, okay.
And you're not supposed to. That was my last clinic, right? Where you're not supposed to take weed or.
How do they
you
test
gotta-
for kratom? How does that show up? Because I don't even.
I don't think they do
fully
test for it.
understand it.
He was very vocal about the fact that
Okay.
he would not stop taking kratom. Like
Gotcha.
he was there, he was in the meeting so that it was mandatory to do group therapy when you started
Yeah.
pain management and when you were on pain meds in general.
Right. Which is a really good idea.
Yeah, no, it was great. Everyone in the group liked it.
Mhm.
It was very helpful. That's where we learned a lot of coping mechanisms and all that jazz.
There we go.
But this guy just would not stop talking about kratom. He's like,
Mm-hmm.
you know, I don't do weed, but kratom, I drink kratom tea. I smoke kratom, and you guys should try it. It's really good. And the psych, or not psych, the therapist looked at us like, he's not a medical professional. He cannot suggest that, and we are not
No.
endorsing that you go and do this.
No, not at all. Like, no.
Guy was straight on about it though. He was
Ugh.
he was legit about his kratom.
And that's the thing. Like, people get really, really gung ho and like defensive almost when you bring stuff up, and they're like, "Oh, that's horrible, and this is the alternative, and doctors are out to get you, and they give you blah 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 blah."
Right.
Or I don't know. It's just frustrating.
And it's not just like pain meds. Like I've had people complain about the fact that I'm on lisinopril for my blood pressure.
Oh yeah. That's like when they took me off the verapamil because I was having fainting spells.
Yeah.
But I had been on verapamil for like years at that
Mhm.
point. It clearly wasn't that. And
Yep.
then, oh my gosh, what was it? Oh, and then I started having the esophageal spasms again. And my doctor was like, "Why did they take you off of that? Like, what was the
Because
purpose?"
They didn't like it.
Yeah. Oh, and that's the thing. Like, between providers, so hard to get everybody to agree on what you're taking.
Yeah, which is why I'm bummed about losing my pain management and my primary within like a month
Yeah.
because they were in balance. Like
Mhm.
it just sucked. My primary liked what I was on for pain management, and pain
Yeah.
management liked what she was prescribing me for everything else.
Yeah.
Everything was in balance.
Yep.
Now I have to do the whole thing all over again. Next time I go into my primary, I have to go over everything.
And who's your new primary?
Oh, I can't remember her name,
Okay.
but I liked her. Remember, she did the small intake,
Yeah, yeah.
and I was like, she didn't know what EDS was, but she was willing to learn.
Yeah, that's right. I couldn't remember if she like knew and had patience or if she was getting like wanting to learn.
Yeah, it was a learning situation.
Yeah.
But now I have to get her happy with my normal list,
Yep.
which is going to be hard.
Mm-hmm.
And then on top of that, I have to get her okay with what pain management's doing, and pain management's going to have to like what I was doing
Mhm.
from pain management. And like, everything's up in the air at this point. All my meds are up for grabs. What do we keep? What do we cut? I don't know. We'll
Yeah.
find out.
That's why I really like with Kaiser I super appreciate their pain management services. I guess their integrated pain services is what it's called. But they have, so on my team, I have a pain management doctor.
Yeah.
I have a pharmacist, and then I have
That's
my
awesome.
pain psychologist.
Yeah.
And then everything's in this, like, it's all in house
Yeah.
because it's Kaiser. But it's really nice to have the pharmacist involved because he can look at my lists and be like, okay, that symptom that you're having might be a result of these medications.
Yes.
Let's run a trial and see what we can do. Or
Yeah.
it's like, no, it's totally okay for her to be taking this because I've looked at all these other things and the interactions or blah, 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 blah.
He also translated it for you that one time.
Yes, which
When
was
you
really
were
nice.
like, I need this to be upped, but not the dosage, so that I
Yes.
can have a dose when I need it, like
Yeah.
a full dose. And
Yeah,
he
'cause-
understood completely, and
Yeah.
and your pain management doctor was like,
because
wait,
she
what?
started to kind of shut down
Yeah.
because what I wanted, because I had been on 35s over 3 months, right?
Yeah.
And then we went to 30 over 2 months. And I was like, can I actually just have 30 doses over 2 months?
Yeah, which meant...
And they were like, what? And I was like, okay, but I'm taking it at like a tab and a half. So I'm taking it at 7.5 milligrams. And I want that dose, but I want 30 of that dose over blah, blah, blah. So I was like, I need 45 to make it that way. And she didn't understand.
No.
But the pharmacist did and jumped in and was like, this is what she needs. And that worked out fine.
See?
So
I wish I could get on Kaiser, which is a sentence no one's ever uttered before.
Right? It's expensive too.
Yeah.
But yeah, no, it's hard to get everybody on the same page with different medications. And then every doctor has their own set of bias.
Oh, totally.
Like biases.
You walk into it. You don't know it, but you're walking into this land of preconceived notions.
Yes. Like who was it? Was it a neurologist? Who was like, oh, it's migraines. And I was like, but you didn't even... migraines.
Or like...
It's just migraines.
Wanting to do the stimulator. Vanessa was against it. But then... oh, God, I can't remember her name anymore. My last pain management doc was totally for it.
Stephanie.
Not Stephanie.
No. Stephanie the new one? Who's Stephanie?
There's
Why
no
do
Stephanie.
I
My
have...
sister-in-law.
There is no Stephanie?
My sister-in-law is Stephanie.
Well, crap. I don't know. My brain's just inventing things now.
Yeah, it's fine.
It's not real people. Yeah. There's other ones like that, because when you talk to the pain, not the pain management community, but like the EDS community, there was some, like a 20-something asking about labral repair. And you had a bunch of people going, oh, no, it was the worst thing I ever did. It's horrible. I wound up with frozen shoulder. La, 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 la.
And there's one guy.
And then we're like,
do it.
No, it's good. Like,
we've done multiples.
It's fine.
I've had 3 of those.
Yeah.
And they were great.
Well, and I think, like, if you do your research and you understand what you have to do to avoid having that bad outcome.
Yeah, you have to be
end,
accountable to yourself post-surgery.
Right. Because if you're not doing the PT stuff... And if you're not moving enough, and if you're babying it too much, you are at a higher risk of winding up with frozen shoulder.
Yep.
Because that comes from not moving things enough. So, I mean, there's definitely a give and take there. But I don't think it's fair to fearmonger and be like, that surgery that could be really helpful for you is horrible because I had a bad experience.
They could have approached it from a point of, I went in, I got frozen shoulder. Here's what you should know before you get it done, so that
like
you don't have...
how you can prevent my fate.
Exactly. Not just it's a bad surgery. Don't do it.
Yeah. Well, and that's like, I don't like nerve blocks, but that's me.
Right. I do.
You had a great experience with your shoulder nerve block. I had a horrendous experience with my hip nerve block, and that was just bad news bears.
Mine didn't work on my hip.
Yeah, they didn't. It was really weird because you had it for a second and then it was done
wearing
before
off
you even went home.
It was wearing off before I went into the room.
That's crazy.
But the
you also wake
spinal...
up so much faster than I do.
Oh yeah, I'm up and awake, man.
Yeah, like you are ready to go.
Yeah.
But I found out that they dosed me halfway through again because I wake up apparently. I just don't remember it.
Yeah. No, I mean that's what we do. Screw it. It's wake time.
Like, burn through it and then don't burn it at all.
I want to wake up and just ask them, how far are we? Cool. I mean, your eyes are taped shut, so just... well, the tube's in your mouth, so I got to learn sign language, but they tape you down. Damn it, there's no way to communicate with them safely. Just be, huh. If I go, huh, know that that's me asking how much longer.
You just, like, wiggle. I think you're paralyzed, though. That's the whole point of the breathing tube. Not to scare anybody. But, like... There are pros and cons to every treatment and every medication and every natural avenue we take, right? But the thing is that, like, when we see things where it's like, doctors don't want you to know, doctors...
They do want you to know, honestly.
Overall, yes. They want to help you. They became doctors so that they could help people. So if there is an option that's not a risky treatment... They're going to try to do their best to look at those options first.
Yeah.
So, well, there was some video I was watching where they talked about how like advertisement in and of itself is a sign you should stay away from whatever it is.
Oh, yeah.
Yeah, like if you have to advertise it,
Then there's a reason.
There's a problem.
Yeah.
Because if it was so wonderful, word of mouth would have gotten around and people would have picked it up and it'd be in the news and blah, blah, blah. So, like, when I see those, like, doctors don't want you to know, and there's this wonderful treatment that you could have, DM me for details.
Mm-hmm.
Scam. And also taking advantage of really vulnerable people.
That's the part that bothers me.
Which is disgusting.
The people who are on there.
Yeah,
and
you
want answers.
Preying on people who are in pain.
Yeah.
And suffering to make a buck.
Yep. Well,
it's
see,
gross.
They can justify it in their minds because it's this thing that's helping them. I'm only helping them.
God, I'm saving them from the medical system.
Yeah, well.
You're like, okay, great, awesome, dick. Is it time to take a break?
Yeah.
Yep. I think so. We're like pretty much right on time anyway.
Yes, sir.
So what do they need to do?
They need to take their medications that they haven't taken yet.
Yep, do that.
We gotcha. We know. We've been
Indeed.
there. Drink some water.
Mm-hmm.
You know, it's okay to drink coffee, but you gotta have some water too.
Yes.
Hydrate.
Like have a good glass of cool water.
Yeah, maybe eat something.
If you can, yeah. And like if you can't eat a meal, have a snack.
Yeah.
Because that's okay and you deserve it.
And take a moment
to just be with yourself.
Yeah.
Yeah. Check in with you. See how you're feeling.
Also say no if you have to. If there's somebody pressuring you to do something, just say no. It's okay.
You're allowed.
Yeah, absolutely.
And encouraged. No is magic. I love it.
Just send them our way. We'll deal with them.
We'll tell them no.
We'll straight up.
I love saying no. I could just do it all day.
No.
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 Mm-mm.
No.
Not today. Today's not it, Chief.
Nope. No.
Right.
Prioritize yourself.
Yeah.
Get some sunlight if you can. Do something nice for yourself. And we will see you in a minute.
Bye. Welcome back. How was your break?
Did you do the things?
Hopefully.
Hopefully.
At least one.
At least I hope you took your meds.
Yeah.
That you were late taking.
It's okay to be late, just not all the time.
Yeah. In different situations. Because if you're late in other places, you might have a baby.
That's true. So
there's that. What are we talking about?
We're going to talk about imposter syndrome and kind of gaslighting, medical gaslighting.
Yeah.
Like kind of revisit it.
Yes.
Because we have a lot to say.
Because it's a strong topic.
Yeah.
It doesn't stop being relevant.
No.
I feel like.
No.
Yeah.
We got into it yesterday.
Mm-hmm. So what is imposter syndrome for those who don't know?
It's the feeling of being wrong all the time.
It's pretty much right. Yeah.
No, it's like in a situation where you believe that I lost my sentence.
It's like when you gaslight yourself to
Basically,
the point of believing that you are like faking.
Right.
Or lying or fooling people or manipulating people when you're absolutely not doing those things.
That was weird. My brain shut off. Like
That's
I literally
been me
blanked out.
this morning, yes. So, yeah. I do this to myself all the time, and I've just recently stopped kind of doing it around work.
Mm-hmm.
But when people tell me I'm good at my job, I'm like, ha ha ha, I fooled you.
Yeah, how did I trick you? That's how I feel about the podcast.
Oh my God, I'm a monster.
When people say they enjoy it, I'm like, how did I convince you? What did I do?
It was all that hypnotism that we put in there.
It's subtle. It's real subtle. But now you're going to notice it, so way to ruin the illusion. There goes everybody.
Look into the fidget.
Don't. It's bad for your eyes to strain them on a screen this tiny. Like.
Okay, let's add some context.
Yes.
So, imposter syndrome in the medical context. This is especially applicable with like how we experience EDS and how it's like this revolving door of symptoms.
Yeah.
I like to think of it as like a wheel. Like every morning you wake up and you spin the wheel for like, what's going to be the problem today? And sometimes it's the same as yesterday, and sometimes it's completely different.
When it's the same, it's worse.
Yeah.
And I like to think of that as like a combo bonus. You got the same one 3 days in a row, it's really going to suck on the third day. Sorry.
Well, and my favorite is like, oh, it's been around long enough that I should probably have it looked at.
Yeah,
and then
that
you
enters-
make an appointment, and it immediately
away.
improves.
Yeah, you're never going to get that symptom again.
Nope. It's
Not
gone.
until you're all alone by yourself.
Yeah. I was supposed to have an MRI of my feet like 3-4 months ago.
Oh, yeah.
And I didn't do that because suddenly they were better.
Yeah.
And I don't know if it's because like those things get better necessarily, or if it's just like other things are
Taking
in
stage.
charge. Yeah. But I think things do get better, especially with EDS. Like if we relocate something stupid and then suddenly all of everything improves.
Well, even what's weird to me is that you can damage something and then it could just stop hurting.
Mm-hmm.
Like with my knees, there's definitely damage there.
Yeah.
We can hear the damage happening when I straighten my knee and it snaps.
Oh, yeah.
Right? But it'll stop hurting after 2 or 3 days.
Yep.
And then
we forget.
Yeah, it's not an issue anymore. So.
And then you feel like a faker because you're like, that was really problematic for a little while. And then I
you talk
suddenly
yourself out of it.
stopped bitching about it.
Mm-hmm.
And then you start thinking about like what other people perceive.
I was about to say, then you enter the territory of they're not going to believe me anymore.
Uh-huh.
Because that thing I was moaning and bitching about is gone, and now they're going to realize
and now it's
that.
different. Oh no.
Yeah.
Clearly I'm in it for the attention.
Yeah, no. Imposter syndrome is everything.
It's a bitch. Like, it is. It's like mental gymnastics to the extreme.
Mm-hmm.
Like our surgeries, for instance.
That's my favorite.
Where,
you did surgery.
Yeah.
You can see the pictures of the surgery. I still believe that they were faked.
Yep.
That they just
like made an incision to shut you up.
And then didn't do anything.
Stitched it up and then woke you up. And they were like, okay, you're good now. Bye.
The first time you told me that you had that happen to you, I was blown away because I thought that was a strictly me thing.
I really thought like I was fucking crazy.
Mm-hmm.
Because, that's some mental gymnastics. Like, your brain has to do all kinds of fucking reworking.
Oh, yeah.
To make that make any sense.
Well, think about it. It's the truth, but you believe the exact opposite.
Yeah. Yeah.
How?
It's like holding two beliefs simultaneously in your head. Yeah. Or like, I believe that, like, I have problems, but at the same time, I'm like, no, you're fine.
I haven't had
You're just dramatic.
the EDS doubting in a while. It's been a couple months since I've gone.
Because EDS has been beating us like over
it's
the head
probably 'cause
with
we've
its presence.
Had constant EDS symptoms.
Mm-hmm.
But I'm having that with my knee because it doesn't hurt anymore.
Yeah.
But I have to get imaging done.
Uh-huh. That's my ankle.
So
I just never did the imaging.
I need to
I was like,
that.
I forgot.
Yeah.
Well, and then my hip improved
Mm-hmm.
because my pelvis reset itself. And then they're like, we ordered x-rays and you should get in with your surgeon. And now it's better.
Mm-hmm.
Fuck.
Right. But there's still damage there. Like, it's still worth it to get the imaging
right.
done, but
Well, especially because, like, I want to make sure that I didn't unduly fuck it up.
Yeah. I had that problem with my back because I've had imaging, and I've had imaging go both ways, where they find something and they don't, back to back, where they'll do an image one day and it's perfectly clean, and then they'll do it again and they'll find like more than one problem.
Weird.
And I think it has to do with the surgeon or whoever they have look at it, the specialist that's looking at it, and how much time they have to look at it.
Well, and how much like detail they're actually looking for.
Right.
Yeah.
Because I feel like I've gotten screwed over a few times by them not looking hard enough.
Yeah. That's how I feel about anything I've had done for like gastro.
Mm-hmm.
I feel like nobody's taking that seriously.
Yeah. But what that does to you as a person, you don't go, oh, someone fucked up. You go, oh, I guess I'm fine.
Yeah. I'm fine and crazy and I'm making it up and it's all in my head and I'm only doing it for the attention because clearly I
hate that one. But you do. You're like, oh, I'm just doing it for attention.
Yeah.
All the time. I have EDS all the time because I want attention.
Right. Which is also hilarious because we mask so hard in front of other humans. So clearly we're doing it for the attention by masking.
Yeah.
And then doing it for our attention when we're alone by ourselves.
Well, the way my brain justifies it is because masking is like second nature almost at this point, right? It's
Oh,
like
absolutely.
default social mode.
Mhm.
So what my brain goes, oh, maybe you're just not faking it anymore. You know what I mean? Like maybe when you're
Yeah.
with your friends, you're fine, and when you get home, you're faking it.
Yeah.
Which doesn't make sense, but that's how my brain justifies that. It's,
Yep.
oh, you're just your natural self around people,
Mhm.
and you're just at home, you complain all the time.
It also
This is
causes
weird.
that like weird thing where we go, I'm having a problem and I want to reach out for help, but oh, I just found out that someone else has a problem
Ugh.
and I can't have a problem at the same time as somebody else because then clearly I'm trying to take away from the attention they like
Right.
need for this issue that they're having.
Yeah.
And I do that one constantly, which
Yeah.
is how I burn myself out. And then I'm like, I need somebody, but I don't know how to ask for that.
I do it with my kids. If my kids have a problem and I'm having a problem, I'll focus on the kids and be like, my thing's not that important. It's fine.
I'm fine. Clearly I'm
I'll be fine.
fine. Yeah.
But yeah.
Oh God, it's an issue. It is
What
a
was
major
specific thing were we talking about yesterday? I can't remember.
issue.
That brought it up. There was something we were talking about specifically. Maybe. It'll
Some
come
of
to
it
me.
was like doctors not believing our diagnoses or
Oh,
questioning diagnoses that were made by other doctors.
Mm-hmm. Yep.
That was one of them.
Oh.
Yeah.
Mm.
Or like how damaging having doctors blow you off can be.
Yeah. Oh yeah.
And like the psychological trauma that people go through and that is not acknowledged by the medical community,
Mm-mm.
which makes me a little bit crazy because like, they have to know it's a problem. They have to come across people who are like dying of something. And you're like, why didn't you get this checked out sooner? And they say like, a doctor told me I was fine.
Mm-hmm.
And then I didn't come back because they said I was fine.
Yeah.
Or like there's tons of these where people get sent home from emergency rooms and then die. at
Oh
home
yeah.
because they were blown off,
Mm-hmm.
which is unbelievable and super irresponsible.
Yeah.
Oh, yeah.
Ugh. Like,
There's some crazy ones.
well, think about it. I did. It's amazing that we have a diagnosis
Mm-hmm.
because I went through 8 years solid of trying to find an answer.
Yep.
But every time I was fine.
Mhm.
Every urgent care I went to, I was too young to have a problem.
I hate that one so much.
I just needed to exercise more because I type.
You know, the other one I get now is, but you look so fit and healthy.
Invisible illness. Fuck off.
Yeah.
That one.
That one bothers me because,
Oh.
like,
But you're so fit and perfect and healthy. There's nothing wrong
Right.
with you.
well, and I get it because, like, I don't know, I'm pretty and thin or whatever.
Right.
And then that plays against me somehow, and
Mhm.
I can't have an illness and be pretty and thin and work out and work full time and,
Right.
and I'm like, I'm doing all of those things to maintain the mask.
Right.
Like, working out is for me, obviously, because I have to in order to maintain the mobility that I have.
Oh, yeah.
And I mean, it has improved things dramatically. I
Mhm.
think over the years that I've been working out, I've gained a lot more like body control and muscle control
Yeah.
and awareness. But like, why does that play against me?
Yeah, that shouldn't be a deciding factor in the problem.
Right. Like people, and it was a recent one too. They were like, "What size pants do you wear?" So I was wearing jeans, and I don't know. I looked cute that day, which is
Right.
always a problem for some reason. It makes me a little crazy. Cord problems.
We're good.
There we go. And so I tell them, and then we're talking about like EDS because it was because I was wearing the brace with everything,
Mm-hmm.
and then it turned into this like, wow, you're so like thin and fit, like you don't look like you have a chronic illness. I was like, hi, I have an invisible illness. Thank you very much.
Mm-hmm.
Just stupid. But I hate that one. Like, why does that play against me?
Right.
Like, why? Because I like maintain working out once a week or twice a week. Like, it's not even like I'm like a gym rat or anything.
No.
I also only eat one meal a day
Mhm.
on average. So there you go. There's that problem.
Yeah.
Disordered eating. It's great. But I don't understand it. I don't understand the mentality of like, you look fine. Like, you have a hole inside of you. Like, that
Oh my god.
there's a lot of insides.
Yeah.
And, like, molecules and shit.
Mm-hmm.
My collagen is busted.
Well, now you just have a new thing to think about for imposter syndrome. Be like, yeah, she's right. I'm perfectly fine. I look so good.
It looks so good. I
can't
can't
be-
possibly have a problem.
Yeah.
That would be stupid.
Mm-hmm.
But yeah, like all of those things, like working out and like, I don't know, dressing professionally and working full time, it all plays into that same mask,
Yeah.
right? Like the I'm fine mask. And you're like, great, I'm glad I fooled you into thinking I'm fine, but
Right. Oh my god.
now you're damaging my own like narrative of myself. Stop it.
You're encroaching on my brain. Stop.
Yes. Yeah. Like, get out of my brain space, please.
Yeah.
And thank you. You're giving me imposter syndrome because I can't be thin and pretty and have problems.
Right. I was
fuck?
too young for problems.
What is that rule?
I was also too fit for problems at one point.
Yeah. Yeah. We
you
get a
typed
lot
too
of like,
much.
you're too young. And you're like, okay. Great. I will be sure to let my body know
I stopped
that I'm
getting
too
that,
young.
but I think I stopped getting it because I have a huge medical history now.
Yeah.
Like they look at my history and it's like surgery.
Yep.
Test, lab, like
Mhm.
major things.
Yeah. What?
Like, look at my history, friend.
Surgery does add to like credibility, I think,
It's helped me.
which is weird and
I still
sad, but also
We'll have surgery and immediately deny it, but it does help. Like, I posted pictures of my shoulder surgery so I
Yeah.
could remember.
that was the second time, right?
Mm-hmm.
Yeah.
I was like, I need to have this somewhere that'll remind me.
That was one of the first times we were talking about it because you were like, I had to put it up there
Mm-hmm.
to prove to myself that that was a real thing that happened.
Yeah.
And that you went through an actual surgery to repair actual damage.
Yeah. Because the before and afters are drastic on that one.
Holy crap. I loved the images of my shoulder surgery. That was really cool.
Mm-hmm.
And getting to see like the stitching to
Yeah.
the bone is really
I really
interesting.
like the stuff they did on the hips because it has that nylon. It
Yeah.
looks like a sheet for a.
It totally does.
So you
for
like you have
sailing.
rigging in your knees. Like,
That's-
hell yeah.
Absolutely what it reminds me of. 100%.
Mhm.
I always think of like, because it's like the white and blue striped. Yeah. It makes me think of main sheets.
Exactly.
Sailing nerds. Sorry. Yeah.
I'm not sorry at all.
Never sorry. Haha.
So one of the notes I have written down here,
Mhm.
it was something that I thought of at the beginning of the podcast, like
Mhm.
when we were brainstorming. But the origin of the masking, like at what age?
Oh yeah.
What age do you start going? I'm normal, but I can't keep up. So you have to pretend to be normal.
Yeah.
But you don't realize you're doing it. You know, you're just trying to keep up with people your age.
Well, I think there's more to it there too. Like beyond trying to keep up with people our age, like we were kind of unfortunately taught
Mm-hmm.
that our needs were not needs and that they would not be met.
Mm-hmm.
And so we developed the belief that our needs were not needs and that they didn't need to be met.
Right. Yeah.
And then from there, it was like plug in the stoic outward appearance for that.
yeah.
Or the crazy drastic rage because you're tired of masking.
Yeah. Well, especially during teenage years.
Yeah.
The outbursts, man. It was so hard to
Mhm.
control everything.
Yeah. Well, it was
Because-
so hard to understand anything.
Yeah. No, we had all these problems that we wouldn't even talk to each other about.
Yeah.
Because that would be like
We
against
didn't know.
status quo.
Yeah. We didn't know that other people were going through what we were going through
Right.
or anything near it.
Mm-hmm. Like, I remember sailing in one of the regattas and hurting myself and then being like told that it's better to not like play it up. You know what I mean?
Yeah, yeah.
Like, so like I'd injure myself and then I'd just have to suck it up.
Yep.
Because that's
Mhm.
what was expected.
It was like walk it off.
You get praised for it.
Yeah.
We had the positive reinforcement for the negative.
Right.
Like,
yeah.
hey, you really fucked up your knee, but you're toughing it out. Good job. Just don't talk about it, please.
Yeah. Also, it's not that bad. You walked on it.
I got that one all the time.
I hate
That
that.
one triggers me so bad.
Oh, it's terrible. Because, like, okay, in the end, limping is so much worse. It is. It just fucks up everything else.
Mm-hmm.
It's not worth it. So babying it doesn't help.
Yeah.
And so you're like, I guess I'm going to just walk on it and experience the sharp stabbing pain every time I put weight on it and just pretend like nothing's happening.
Yeah. I'm thinking back to it. I can think of one of the first times that I had like a major medical need that I was told that wasn't a medical need was when I broke my foot.
Oh, yeah.
To the point where I didn't realize I broke it until like 5-6 years later.
Mm-hmm.
So right now, in my foot, you have those tiny bones that should be meeting like this, right?
Yeah.
In the middle of your foot. It's very apparent that it's doing this now.
Ooh.
You can feel the end of the bone. You can feel into the
Yucky.
divot where it's sticking up out of the skin.
I have something like that so I broke my shin working for AMC one day. I was like, I had a bunch of things on the dolly. And when I went to put the dolly down, it like slammed into my shin at an angle.
Yeah.
And I have a literal dent in the bone from where that came down. And I remember being like, that hurt a lot. And putting weight on it hurts a lot.
Yeah.
And then going to my supervisor and being like, should I like get it checked out? Like, should I do workman's comp? And he was like,
no,
nope.
That's a big deal. Yeah.
Yeah.
They would not
And he
want
was
you
like,
to.
no. And then I didn't.
Yeah. No,
And I just walked on.
I told somebody in charge, and that I was like, look, my foot's messed up. I can't walk on it. And I was told, oh no, you're fine.
Yep.
If it was hurt, you'd be crying.
Yeah. Oh.
If it really hurt, you'd be crying.
I feel like doctors do that too.
Mm-hmm.
Where they're like, it can't hurt that bad. You're sitting here talking to me.
Right. But we
and you're
were
like,
trained to not react to pain.
Right.
Like,
Yeah.
I walked around on it all summer, and it hurt. I remember very distinctly, it hurt all summer.
Yeah.
And it got worse, and I was just like, oh, God, I guess it's just a bone bruise, like a really bad one.
Yeah. Oh, I hated hearing that. It's just a bone bruise.
Mm-hmm.
Everything's just a bone bruise.
Yeah.
You're like, what the fuck, bro?
But, I mean, that's like the beginning of it for me.
Yeah.
Because I was alone for most of my childhood. Like, I had friends and stuff, but when we moved to Deming, I was all alone.
Yeah.
I spent that whole year homeschooling. And that was when I got a T-post through my leg that we didn't go to the doctor for because there was no way to make that happen.
Yeah.
So that one, like, I get. That one that I was validated. Like, there was a problem.
Yeah.
My mom was more worried about it than I was. But, like,
that was also really
moving
strange.
to Colorado, I had to adjust to, oh, you hurt something, you're just suck it up.
Yeah.
So I was like, okay.
Every pain you feel is temporary, but also like, shh.
Yeah.
Like, it's temporary as in, like, stop it right now.
Mm-hmm.
Yeah. No, it was always like, it'll heal itself.
Yeah, there was a lot of that.
It'll heal itself. I'm trying to think what other, like, ridiculous ones had happened. Because I get the, like, you can't be in that much pain with doctors a lot until they either see, like, my history or my imaging or, like, talk to me in actuality. Yeah. And then they're like, oh.
That's why I always pick, like, the most dramatic things. Like, my 10 on a scale is when they cut my back open and I had to recover from surgery without pain meds. That's my 10.
That was really bad.
Well, and I did it right off the bat, too. I didn't take the morphine bolus.
Yeah.
I didn't click it once for the first 6 hours.
Oh, my God.
Nothing was in my system, and I'm sitting here crying, and the nurse is like, what's wrong? And I'm like, I didn't want to push it because I don't want you to think badly of me.
Yes. When I came out of my right hip surgery, I was in, like, agony. I was in so much pain. And it wasn't even my hip. It was, like, up in my abdomen, I guess.
Oh, yeah. I remember that. Yeah.
That was the beginning of all of the, like, really bad side pain and the pelvic pain and all of that. Because I think something happened with my, like, psoas. I think it had to have been.
Yeah.
But, oh, that was bad. And I was just like, I was in so much pain. And then finally they're like, honey, do you want a pain medication? I was like, no, I want to save them for later when I get home. And they were like, no, you can have one. And I was like, but I don't want you to charge me for it. It's fine. I'll wait till I get home. And they're like, take this pain medication, please.
Yeah.
But, like...
That's just funny shit. I can't believe we both did that.
Yeah.
Like, no, you don't understand.
It's fine.
I was for sure that they were going to think badly of me just for using the bolus that I needed.
Well, and it's so weird because, like, when I had PT, she was like, essentially, the pain that you should be in is like you broke your hip. Because they shaved down the ball.
It was supposed to be that bad?
Yeah. And they shaved down the inside. And she was like, your actual... Because I remember the images? Your marrow is showing.
Yeah, exactly.
And they're like, it should be that painful. And the PT was like telling my husband, she was like, that's the kind of pain that this is like if you had broken it. And I was just like, oh, interesting.
I never had that for reference.
Yeah.
That was not that bad.
No, and it really wasn't.
Even in recovery, like, I didn't need pain meds 24/7.
No.
I just iced it.
For the first hip surgery, I did, I think, it was like 3 days of taking the pain meds as directed.
Yeah.
4th day, I started to wean down, and then it was just at night.
Yeah.
Because I was fine during the day. Like, I was just hopping around doing whatever. And unless somebody, like, kicked my leg or something, or a dog ran into me, that was really bad.
I remember
when the dogs ran into me. Yeah. Oh. But yeah, like, it wasn't that bad. And then you, like, were programmed with the imposter syndrome and the medications go together, like, hand in hand.
Yeah.
Because you're like, oh, I don't need this. I just want it, and I'm going to get addicted. Am I addicted right now? Maybe I'm addicted. I don't know. Should I stop entirely to find out if I'm addicted?
I do that all the time.
Constantly.
Yeah.
Yeah.
Every time I take one, I think that at least crosses my mind at least once.
Right.
Like, you're a shitty person for doing this.
Yeah.
Like, oh, okay.
And that's really fucking sad. Like, really sad that we can't. That's my alarm. Sorry.
Oh.
That's the stigma that's plugged in there.
Yeah.
Is that, like, you have to take pain medication to be a functional human, therefore you are not worthy.
Yeah.
Like
I can see the results in my activity levels for all my meds, right? Mm-hmm. But I still, I'm like, yeah, I don't need them. I don't need the Concerta.
Yeah.
But I do.
Yeah.
Like, desperately.
Yeah.
I feel that way about a lot of them.
Right.
Where I'm like, I'm just taking these now at this point just because they're on the list.
Right.
Not that I need it.
Do you remember the days of, like, I'm going to stop taking everything because clearly I don't need any of this and I'm crazy and I deserve this.
Dude, I had one of those moments. I was real fed up with everything.
Mm-hmm.
And it was like recently. It was in the last few months. But there was a day where I was like, fuck it. I'm done.
Which is bad. Don't do that.
I'm going to abruptly stop all my medications and then build my way back up to what I need. We'll start with lisinopril.
I even asked my doctor if we could do it at one point. I was like, can we, like, drop off everything and then figure out what I actually need? And he was like, that's stupid.
Lord,
and
no.
No.
God damn it.
Like, if you want to lower some doses of some things to see, like, we can do that, but...
I'm supposed to do that with
no.
David. They were supposed to lower my medications before this last refill.
Really?
Yeah, I talked to Megan about it. That's Megan. I remember her name now.
Oh, good.
And we were like, we're gonna reduce it down to 7.5. So I was like, good. Like, that was my idea. She made me wait 2 months.
Yeah.
And I was like, okay, fine. We'll wait 2 months. And then she stopped being my provider.
Weird.
Yeah.
Yeah.
So they just renewed the one I had. So when I see David, the first thing I'm gonna be like, can we reduce these? It's summertime.
I know. We have to do that, like, power move where we're like, look, I don't need them and I'm not addicted. Take me seriously now.
Please. Well, and I like to go lower for the summer so that if I have to increase it for winter, I'm not always going up.
Yeah. My next refill's going back to 30.
Yeah.
Instead of the 45, which is good.
Yeah. So my goal is to get down to 5s at some point.
Yeah.
That's the goal.
I got to get you, like, moving over the summer.
Mm-hmm.
See if you can be my workout buddy.
Well, the problem is that I have damaged things at the moment.
Yeah.
Like, I want to work out. I want to ride the bike. But I tried it the other day and it just snap. So I need bands. I need to pull up my band exercises.
Oh, yeah.
And do the, like, gentle.
I have bands.
I have a bunch. I have, like, from light to heavy.
Yeah, yeah.
Just over the years.
I have a bunch from PTs, yeah.
Yeah.
I was looking at, like, getting kettlebells.
Oh,
because a lot of the stuff that I know how to do is, like, I don't know, it's like a lot of isometric stuff and very controlled movement stuff that I think you would really like and benefit from.
Yeah.
But they're expensive.
Mm-hmm.
So I got to convince my husband that that's a worthy buy.
It's easier to justify that than buying a blanket. Just saying.
Shh, the blanket would be in secret. That's the difference.
It would live here.
Yes. If
Be your
I bought
secret
another
blankie.
blanket, because here's the thing, friends. I'm like hopelessly addicted to So Sweet Minky designs.
I have one and I love it.
We're
to
not
pieces.
sponsored at all, but like
We could be though.
that stuff's amazing. And every time I see them, and it's not fair. They like figured this out. They have it down flat because can you imagine all of these like neurodivergent people who love textures or hate textures, and then there's a world of super soft, lovely handmade blankets with different textures.
Mm-hmm. No, dude, I love mine to pieces.
Right? Oh my god, they're so nice. And I have a few now, so
They're not cheap.
yeah,
They're
no, they're not cheap.
$200.
And my husband would be like, "You don't need another one.
I do
You
though.
have like 4 of them."
I need one
So-
that I need one for bed and one for nest.
Yes.
That's what I need. So I've got to come up with $200.
No, what'll
And
happen
spot
is I'll
them
see
on
one.
sale.
I'll see one and be like, and then I'll buy it and have it sent here. And then you will have a nest blanket.
Yeah.
And it'll be wonderful. And I'll have it for lap on podcast.
Yeah.
That'll be about it.
This is my podcast blanket.
But I'm like, I want to know all the textures. And you can't
I
like
wanna know them
feel
all.
them before you buy them.
She's
you just
gotta
see
catch it like
them.
Pokemon.
Exactly. And that's the whole problem.
Yeah.
Like I could literally collect them all and feel so much joy.
So much joy.
So much joy. So if you're interested in joining my nonsense, it's So Sweet, like SEW sweet.
Yeah, so sweet.
Minky designs. And they're on
So
Facebook.
we need to reach out to them and see if they'll
Right?
sponsor
Be
us.
like, hey,
We have a very small
I
reach.
just plugged you, but yeah, there you go.
You want to send over some samples?
Right?
We could do a little sampling.
Hell yeah. I would be so game.
Turn
for
it
that.
into a So Sweet podcast.
Right. I've never had something like, because it's totally one of those like panic buy things
Mhm.
almost,
Oh, yeah.
but it's not something I've ever like regretted doing. I've never bought one and be like, oh wow, this was a really bad
What
idea.
was I thinking?
Oh my god. I'm like, oh, this is amazing. I want more.
Yeah. Well, and I didn't get it fully. Like, I understood. And then, like, I was like, oh, cool. So they're like comfy blankies and like they're expensive. I get it. But then when I got one, holy shit.
Uh-huh.
I was like, I understand.
Yeah, they're so
Because mine is 3 textures
hmm
and it's zebra print.
It's amazing.
I love it.
They're so fun. I love them.
Mm-hmm.
Wow, that was a lot. We're like imposter syndrome and blankets.
Well, tangents.
Yes.
We put it on the second half because there's,
It is kind of our meander-y time.
yeah.
But yeah, no. I can't
Imposter
imagine what I would love to hear a therapist's take on the damage
Yeah.
that can be done through like gaslighting
Mhm.
and downplaying and not
Gaslighting
having
yourself to oblivion.
yeah, and it all like stems from that thing of like not getting your fucking needs met.
Yeah.
And for us that started in childhood, and so we were like pre-damaged by the time we got to the medical community.
Well, and the medical community did its own.
Yeah.
Gave me the fucking runaround.
Yes. Well, because it took forever. And anywhere we went, we were treated like hypochondriacs.
Oh, yeah.
And then on my record at one point, I did see that it had,
Over.
you know how they put like conversion syndrome
Yeah.
as a like fuck you diagnosis? I fucking hate that. I hate it.
Did you have conversion on there?
Yeah, for a second. That went away
Ooh.
really quick. But at one point, that was on there. And I was like, excuse me, no.
I had
No.
over-medicated.
Oh, yeah.
That was the worst. Over-medicated is not what you want on your fucking medical record.
Uh-huh.
Especially when you have a complex about taking these meds.
Yeah.
So I'm glad that it got removed.
Yeah. Well, and it's
Marianne
like,
removed it.
stupid. It's so stupid. I just got anxiety removed fairly recently.
I'm never going to get rid of anxiety. Because I have anxiety.
Mine's mostly well controlled.
Well,
'Cause I've like
so at what
developed
point At what point are you better enough to not have it on your list? Because I don't have anxiety when I'm on my meds, and I take them regularly. So my
I think it depends on, do they make you do those like improved outcome surveys?
yeah,
So I think
I used to do a lot of those.
Yeah. So I think for me, it was probably enough of those that showed enough data.
But it's not like
that
they're going to
they were
stop
like-
your medications.
Right. They were like, you're doing well on your medication. I don't think this is something we need to focus on
Oh
right
man,
now.
no. My bipolar tendencies are all under control.
Which is great.
Fucking depression, everything's been really good.
Yeah. Yeah. It's been, even though the weather is bludgeoning us, I think we've been.
That's a good way to put it. Just left and right.
Oh,
left.
it's horrible.
Ow,
It's
stop it.
horrible. I'm so done with it. Like, just let the weather even out and then I will feel better.
Yeah.
Hopefully.
Hopefully.
Please. Just please. Yeah. But God, I would love to hear like a professional's take on that damage and how that works.
Honestly, if people would do me a favor and write down, like, comment their biggest moment of imposter syndrome.
Mm-hmm.
Because I had, like, it's really interesting to see what your brain will come up with.
Yeah.
Or what you'll believe, even though you know it to be untrue.
Right. Like, our surgeries were faked. Conspiracy theories.
I still do it. I'm going to pain management for the first time. I'm like, oh, God, I have to prove to them I'm ill. I guess I'll just fake it.
Right?
But I'm not faking it. I'm just letting them see it. But it's a performance.
That's exactly
so it's
it.
fake, but
That
it's
is
not.
literally it. So my pain psych likes to break me, as I've stated previously. So we got to the point where I was like, I don't know how, because we talked a few episodes ago about like chronic loneliness and how it, like, we train people not to be soft with us.
Mm-hmm.
And then we're like resentful and upset because we want them to be soft with us.
Certain times,
At
not all the
certain
time.
points, yes.
But yeah.
But we do all of this like training because we are trying to manipulate the narrative before it can be formed,
Mm-hmm.
like, naturally, right?
Yeah.
We're trying to be like, set the stage for, yes, I'm chronically ill. Yes, I'm still capable. No, I don't need your pity.
Yeah.
Right? That is like the basis of that. And then she goes on and we dig a little deeper and get to this point where as children, we did not have our needs met consistently enough that we kind of developed this core belief of, if I ask for my needs to be met, I'm an inconvenience.
Yes.
Or I am the problem, which is
That's
term
the wording
sticks
that
with
hurts.
us.
Yeah.
We're the problem. So with that core belief, we have a hard time like letting anybody take care of us.
Mm-hmm. Yeah.
And then if we do let them take care, like, how do you go about unmasking when the mask is the default?
Right.
That's
where
really
it's
where I was trying to
performative.
get. Yes, exactly.
That's where it's like, quickly perform pain.
Yeah. What does pain look like on other people?
We got to come up with an interpretive dance for it.
I don't even know what it's supposed to look like anymore.
No. Well,
Like, what is that? What is
the
this
only examples that
sensation
I
look
see are
like?
when people are faking it in the ER.
Yeah.
And you
Like,
can
playing
tell
it
they're
up.
faking
Mhm.
it. It's like, you're not that bad off, because as soon as the doctor left, all the whining and moaning went away.
Uh-huh.
But as soon as the doctor was there, the whining and moaning came back.
Yeah. And then you're like, I don't want to be like them. Ew.
Yeah, well,
And then we have to be like them to get our needs met. Shit.
sometimes.
Mm-hmm.
Sometimes it doesn't go badly.
Yeah.
Usually it goes badly.
If I have, and this is, I think, the like big difference in care when I have a problem with like female doctors,
Mhm.
is because they are waiting to like be a little more nurturing and a little more understanding of things. And when I am a flippant asshole and I'm like, I'm broken, but it's fine, they're like, you're fucking weird.
Yeah.
And clearly you're not in that much pain. So fuck off.
Yeah, your approach is different than mine. I get
Yes.
sympathy.
And then
Not that I want it,
Right.
but I get it.
And then with male doctors, I get the like, oh, like I'll be like, I'm busted, ha ha ha, and they're like, yeah. let's get you taken care of. Let's see what we can do to like make you more comfortable.
That's my preferred doctor right there.
yes.
That can make jokes with you about it. Like,
And
look at your
that's-
chart and then you laugh and they're like,
That's how
okay,
that works.
you're a fun patient. Good.
right. Yeah. And then like when I was in really bad pain. The first time I dislocated my right ankle was great because I was laying in bed and I had it like propped over the other leg, and the dog jumped on the bed, and my foot went downward and my ankles stayed, like my leg stayed
straight
up.
Yeah.
And so I had this like and then I went to relocate it and I ground the bones against each other, and I wanted to vomit. And so I went in and I was like, I'm pretty sure I set it, but like, could you check and make sure that it's set appropriately?
Mhm.
And so they were like, yeah, it's set, but there's still a little gap here. Like, it looks like you got most of it. And because of that little gap, they were like, let's get you some morphine. Because they believed that I had it dislocated and relocated.
There was evidence.
Yes.
Yeah.
But there's not always evidence because we have this horrible habit of fixing ourselves in the fucking waiting room.
The first time I went in for my shoulder dislocation, I set it myself, but we went in anyways because I was, again, same thing. I was like, I want to make sure it's okay. And they tried to set it themselves, but it was already set. So it just hurt really bad because it was all swollen.
And they're just pulling the muscle.
Yeah, they didn't take images or anything beforehand. They just went straight for it. They're like, all right, this is going to suck. I was like, okay, go for it. Knock yourselves out. I already got it, but sure.
Yeah.
Yeah.
I don't think I've ever had anything set in a medical setting.
Me either.
Yeah. And then that works against us too, because then they're like, oh, where did you get it reduced? And you're like, I didn't.
I have a friend in sports medicine who helped me.
Oh, that's smart.
Because Carrie
Smart.
was in sports medicine.
That's
so
really smart.
I have someone in sports sports pain management that'll help me.
That's crazy.
I'm a smart one.
That is smart. Damn it.
Yeah.
You should have shared that tidbit before.
I didn't think about it till just now. I haven't gone in for a dislocation in like years.
Yeah. Oh my God.
If I dislocate, I fix it.
Exactly. And then they're like, wait, what? How many times are you dislocating? You're like, multiple times a day. But it's okay because I know how to fix it.
We should end it.
I think so too.
It is time.
It is time. Well, thanks for coming along with us. I'm sure this one was a little bit all over the place,
Yeah,
but
it'll be fine.
Hopefully it's a good one.
Good conversations were had.
And if you liked it, go ahead and share it with someone you think would also enjoy it or get something useful out of it. And then like and comment and then subscribe.
Just say that. Really, just comment.
Yeah, the comments are what we like really get excited for.
Yeah. So remember, if you haven't commented yet, comment about your worst imposter syndrome moment.
Yes. Or like the highest gymnastics you've had to do.
Oh, yeah.
Mental gymnastics.
But yeah, that should do it.
Indeed. All right, friends. Until the next time, be good to you, be good to others, and we'll see you in the next one.
Bye.